Hello and welcome. We're here today in the Davos Alzheimer's Collaborative Brain House studio at the World Economic Forum in Davos, Switzerland, the annual meeting. I want to thank all of you for joining us. We are excited to be part of the first ever Brain House at the World Economic Forum, which DAC created to explore the connections between brain health and the pressing global issues traditionally covered at this gathering in Davos each and every year. My name is Richard Louie. I'm an anchor over at MSNBC and NBC News. It is great to be here with all of you. And I'm not sitting alone. I don't know if you could tell. And our conversation today will be with two very big thinkers on a very important topic. Each of them has their own. Margaret Meagher is the Chief Impact Officer at Crisis Text Line. Good to see you, Margaret.
Nice to see you. Thank you.
Harris Eyre, good to see you, Dr. Eyre, and I'll call you Harris after this because that's what you'd like me to do, right? Is the lead and senior fellow for the neuropolicy at Rice University's Baxter Institute for Public Policy. Is that right?
Baker Institute.
Baker Institute.
James,
all right.
James A. Baker III.
James A. Baker. Yes, absolutely. Also love your business school at Rice. So tell me why you're both here and what you hope the conversation might include at this annual meeting. And Margaret, you go first.
Thank you. I think our attendance at the World Economic Forum was really sparked by a conversation that Harris and I had a couple of months ago when we first met. And we realized pretty quickly that we're each working on complementary sides of a really important issue at the forefront of the world today. So Crisis Text Line works in essentially what we do is simple and powerful. We are a crisis response organization that provides text-based mental health crisis support to people 24/7, whenever and wherever they need it. We're a free nonprofit, and that fits into the ecosystem work that Harris is doing, so I'll let you speak a little bit about that.
Wonderful. Thank you, Margaret. And yeah, so Richard, I'm here to advance the brain economy. The brain economy is a bold new economic paradigm that we're actually talking about at the annual meeting on Thursday. And it's all about how do we see this escalating cost of mental and neurological issues that's in the trillions and it's rising, and how do we actually bend that curve, talk about prevention, talk about brain health and brain performance across the entire economy, from healthcare to the care economy to digital and beyond. So that's what I'm here to drive, and it's important that we match these high-level economic transitions with really good examples of organizations doing it like Crisis Text Lines. That's why our work is hand in glove.
What do you do at Rice?
So at Rice, I run the neuropolicy program at the Baker Institute for Public Policy. And I spend my days driving this brain economy work. I tell stories, I write papers, policy papers, engage with politicians, businesses, philanthropists, and trying to essentially create an ecosystem around the brain economy in collaboration with the McKinsey Health Institute and the World Economic Forum, and trying to really catalyze a movement.
What's the state of your market, Margaret?
Well, basically, the problem is enormous and it's only getting bigger. And I'll speak a little bit to Crisis Text Line's footprint in the solution side of that.
Sure. And you're global, correct?
We are global, right. We are global. We started 11 years ago in the U.S. And since that time, we've supported 11 million crisis conversations in the U.S. that cross every state and every county in the country, offering support in English and in Spanish. And we also have supported a total of 14 million crisis conversations across the world now that our model has been adopted, and we're working with affiliated partners, Kids Help Phone in Canada, Spun Out in Ireland, and Shout in the UK.
What's the cost to the economy?
Well, for us, that is, last year alone, for example, 1.4 million conversations in the U.S. that we supported, each one on average about 45 minutes long, which is about the same as a clinical appointment.
Yeah, and how many messages in that conversation? Because these are text messages going back and forth, right?
Millions of messages, and yes. And
in the 45 minutes, that must be a lot of back and forths.
Yes, absolutely, and it's right now multi-millions of messages that we have in our data set. So we essentially have this trove of knowledge that rests within the data of the conversations that we have.
That is private.
That is private.
Anonymous.
Yes, anonymous, private, de-identified, and that data is something that is part of what we use and makes us unique to be able to bring information to the field on what is driving the stress and duress of people across the country. We put out an annual report on trends report on the state of what's happening in crisis conversations. We can also use that to do many other things like improving our service, to inform the field in terms of best practices, and also work on suicide prevention.
What is 80% of the crises that you address through your crisis text line?
Well, as you can imagine, there are so many co-occurring issues that,
Sure.
that people present
I understand,
with, right?
yeah.
So I think...
Overlap, right, just, yeah.
Exactly. So that's one of the things that we're working on in terms of applying the most contemporary tools that you can imagine in terms of natural language processing, machine learning. We're using that to really understand in more fine-tuned, nuanced ways. But I can say that the top things that, the top topics that drove those conversations as tagged by our volunteers after the conversation: relationship stress and duress, absence or stress within relationships, so loneliness, isolation, whole gamut of things that you can imagine.
Now, with what you do at the Baker Institute, what percentage is that of all that you're looking at? The vertical that she's talking about.
I would say that mental health is half of the issues of the brain economy, of the whole economy of sort of mental and neurological issues. So it's 50%, and it's super important. And I think we've seen, with COVID, the rise of particularly youth mental challenges, but as you know, with the rise of Alzheimer's disease, caregiver-related stress is also a big sort of mental health intersection. So yeah, it's about half of my work.
What's the size of it? Please.
Well, I was just going to say, one of the things that I think really got us excited when we first met was crisis text line. Essentially, yes, we have an intervention that is the frontline intervention for anybody in crisis. Whatever their crisis is a crisis to us, and our volunteers are trained to deal with the entire spectrum of whatever it is that is driving somebody's stress. We also have another intervention that's essentially our training for our volunteers, and that training is something that is super exciting. Because what we can see is we've done some recent research about the impact of that. The training itself is an intervention in prevention and positive well-being for the volunteer themselves, for their families, for their communities, even their places of work. And in this case, we found in our recent research that it's also strengthening intergenerational ties, and it's a really positive intervention for populations of all ages, both younger populations who are emerging and struggling with
the ripple effect of teaching people how to fish, if you will.
Yes, yeah, the things that we're losing with
That's
respect
right.
to technology on a daily basis.
What's the other 50%?
The other 50% is what I would describe as neurological challenges.
Sure.
So the challenges of Alzheimer's disease that are rising, particularly in the global south and the global north. So that's a big issue. But then you think about things like Parkinson's disease, which is rising, multiple sclerosis, and then issues like autism and dyslexia. They're also very important when we think about how are we going to really transition our economy from right now. We deal with people when they're downstream, when they're struggling with crisis and challenges. How do we go upstream? Think about prevention and early intervention.
What's the number what are some of the numbers, I guess I'd ask you, Harris? Give me one or two that you attach to this brain economy, because it seems to somebody who doesn't know it well, either very small or very huge.
Yes, so good point. The Institute for Health Metrics and Evaluation, which is probably the best global health data group in the world, they say that the cost of mental and neurological issues to the global economy is 2.2 trillion per year, and that cost is rising at 5% a year. So that's one number. And then another number from the McKinsey Health Institute suggests that if we can enact a brain economy successfully, where we are essentially preventing and intervening right when we can, that value to the global economy in productivity is 26 trillion. And that's about the brain is the seat of creativity, productivity, well-being, social cohesion. So if we have the best brains possible, then we're going to really, be much more productive individually as businesses, and then as nation states, and then globally too.
Okay, that's good sizing. Thank you for that. And then, so Margaret, when you think about the potential that's out there, you got a sense of productivity, for instance, especially when it comes to mental health and mental illness. Again, as a journalist, we know that we sometimes see that those very ideas are conflated. Give me the 30 seconds about how you do not conflate mental illness and mental health.
So First of all, we don't do any diagnosis in our work, so we do not diagnose any kind of mental illness at all. We just support mental health and mental well-being in the care that we provide. So right there is a distinction in terms of what we do and what we offer. And then I will say that, for example, about 20% of those who reach out to us are suicidal or experiencing suicidal ideation in the moment that they reach out. The other 80% are not. Those are folks who are dealing with other kinds of life issues that they just need someone to talk to, someone to be able to help them unpack, step down from that precipice of really being escalated in their emotions. And that is not a mental illness, that is just a moment of duress.
You don't want to finish with this. How can industry help accomplish both what you are striving to accomplish? And that's very general. And then very specifically, and you can do either one first, what do you hope you walk away with from this annual meeting in terms of a relationship or a decision or a collaboration that comes, if you had to define it for me? And I'm only going to give you 60 seconds for both of those all together. And I'll have you go first.
So I think we're hoping to first elevate the opportunities that exist in taking different approaches like the model that we have, that essentially is tackling both response and prevention at the same time, and that's also eminently scalable and it's localized in terms of how we're doing this. So I'll give you a specific example. We supported those 1.4 million conversations last year in the US alone with a staff of 220 people. 80 of them are clinicians, and 15,000, almost 16,000 volunteers who are actively supporting 1.4 million moments of crisis, all for the total of about $40 million. And that is eminently scalable anywhere in the world, because everyday people who care about the people that are around them in their lives can be found everywhere.
So what do you want?
We would like relationships, investment, and continued resources, and to be able to partner with organizations so that we can continue to be part of critical ecosystems and continuums of care.
I love your question. I would love, by the end of this week, to essentially engage the finance sector in the brain economy. I think we have good pharmaceutical engagement, we have good advocacy, non-profit philanthropy, but we know that there are trillions of dollars sitting in asset management, in pension funds and sovereign wealth funds. How do we channel that money into the brain economy to drive prevention, early intervention, and better brains for people? So that's what I'm hoping, the BlackRocks of the world, those types of organizations. And then my other goal is that we're going to launch a World Economic Forum McKinsey Health Institute Brain Economy Dialogue series on Thursday. And so I'd like people to tell me in which part of the world and on what topic should we hold a dialogue.
I think you might get 194 responses.
Yes, well, that's good. That's good.
That is fantastic. Well, I lied. Quickly, what's the reaction that you typically get when you're describing what you both do? And you only have one word. So what is the typical reaction you get?
Wow, thank you.
When you hear the brain economy, people say, huh?
What do you want the response to be?
Wow.
And what do you want it to be?
On the same, wow, and let's do this.
I thought both of you would say, so you're going to be a partner, right? We're going to do this together?
Yeah, support us.
Yeah.
I mean, ultimately, right now, Crisis Text Line supports, our service is accessible
Yep.
to 5% of the world through the 4 countries that we're operating in. We would like to take that to 25% of the world in the next 5 years, and we just need resources to help scale.
And people generally say to me, tell me more. But that's more than one word, so I didn't want to go
Y'all
there.
are way over, it's okay, but I knew that. I'm the one that did it to both of you. Margaret Meagher, Crisis Text Line, thank you so much. Dr. Harris Eyre from Rice University, thank you for your work as well. Thank you both, and thank you for being with us here at Brain House at the World Economic Forum in Davos.